I walk because I need to walk, first of all. I need to keep active in my life so I can stay healthy.
I walk because I wanted to meet new people. I wanted to be able to have an exercise that I could do regularly. And if you have a group of people that you start to get to know and you get to meet, you're more apt to continue to come and to go.
I walk with the dog because I love the environment, I love the friendships, and I'm inspired by what I see that people achieve.
I walk to spend more time with my patients. I walk to clear my mind. I walk to get ideas. Honestly, when I'm walking, I'm not thinking about hopefully preventing a heart attack or cancer. I'm walking for clarity. When I was a resident, that's right after med school, and a cardiology fellow, we're afforded a lot of time with patients. Instead of seeing now 10, 12 a morning or afternoon, we would see 4 or 5. So we're allocated about an hour, and we'd spend time talking about, controlling blood pressure, cholesterol, diabetes, but it also allowed me to spend a lot of time focusing on getting patients out and into some type of active lifestyle. Unfortunately, in the office, probably anecdotally, about 5% of people are living an active lifestyle concordant with what the guidelines recommend at 150 minutes a week. So I would spend, and really enjoyed, 20, 30 minutes with the patients, kind of delineating a plan and coming up with an approach. And when they left, I was really excited for the next 6 or 12 months to pass by so I could see their progress, because I really felt I was good at it and I had connected. And it took me 2 or 3 years to realize that I was almost totally ineffective. And when those patients came back, that conversation, which I thought was very meaningful, really didn't have much meaning whatsoever. So one day I just said, how about if my patients, one day I said, what if my family and I join you at the park? Would you have any interest? And that was really kind of a magical moment. I don't like using the word magical because it's too ethereal or whatever, but it was really magical. People just kind of gravitated around it. Initially, the patient, my nurse walked out of the room and said, my husband's working that morning, how about if I come check blood pressures? And it spread through the office very quickly. We had a lot of people that I had not talked to about it coming up and wanting to help somehow, and then it spread out of the office pretty quickly, and that's why I think it was a gift. I think we got really lucky because it really brought people together.
I think, when you're in a traditional office, it's sterile, you wait out in the lobby and then, they take you back and, sometimes you have to wait in the lobby longer if somebody else needs additional help or care. And when you're at the walk with the doc and you just get that one-on-one, or he's always laid back, he's normally wearing blue jeans, and so you just feel really comfortable, you don't have to worry about office politics and stuff like that. We can just be more casual in our conversation, and I think that those are some of the benefits that you get.
Well, I'm kind of a hypochondriac, so when I go into the doctor's office, I get all worked up, and my blood pressure is usually high, and I forget, things that I want to ask him, or I'm worried about is this really serious, and that kind of thing. And usually he would come in, and the doctor's the one that told me, you have white coat syndrome. I didn't realize what that was, but he said, well, wait a little while, and he talks to me and kind of takes care of things first, and then he'll take my blood pressure after that. But I don't have that so much anymore.
Doctors, when you go to doctors' offices, they got the white coats on, or and you feel it's hard to talk to doctors, I feel, because they're all educated, and they talk at a different level than to me, and I just feel sometimes scared, most doctors.
I think you get in certain mindsets when you're in the office as a patient. And there's fears associated with that. How much is this going to cost? Am I going to get bad news? Is he going to, want to stick a needle in me? And it's just, that's why there's white coat hypertension and blood pressures can go up. It's kind of an anxiety-filled setting. When you're out at the park, it's almost the counter to that.
Being there at the walk with a doctor, Dr. Sabgar, he dresses in running shoes and jeans or shorts sometimes, and a t-shirt or a running shirt, and just gets down, and he's a human being. And he talks to you, and he gives you some advice and medical, and he talks to you, and he walks the walk. He doesn't just talk the talk like a doctor does. He becomes a human being. He shows you the same thing. He lives a life with you.
You have the opportunity to be able to go up to Dr. Sabgar and talk to him about anything. Again, he's a cardiologist, but if he doesn't know, he'll say he doesn't know that, or he can refer you to somebody. But I think the biggest thing is just being able to feel like you can go up and share about any particular health concern that you have. Of course, that cardiology is his specialty, but I think that he's willing to talk or to share, or if he knows other doctors that are talking about a specific area that he feels comfortable, he'll divulge that information, and I think that's the biggest part.
Knowledge is power. So we want people to feel educated by our docs leading the walks, either by talking to them, hearing their talk, or the newsletter. We really advocate for 150 minutes a week of overall moderate physical activity. So it's something that, obviously within the name, it's very important to us. That's why we're out there, one of the main reasons. And then empowering. We want our community members that come to the walks around the country to feel that they're in charge. I think there's maybe a prevailing thought for a lot of people that it's fate, and either they're going to have a heart attack or they're not, or they're going to have cancer or they're not. And of course, there's situations where that occurs, where people maximize the risk factors, and we all know that there can be some luck involved, but we feel, and the studies show, that 80 to 90% of this stuff is preventable. So we want to empower the people that were fortunate enough that they want to be a part of Walk with a Doc, that they can make a difference.
It makes it easier, I guess, for me to talk to my doctor. I guess I should probably write down all the questions I'm thinking about as I'm walking and talking, and what's going to work best for me. And occasionally I will call my doctor and say, hey, I heard at Walk with the Doc that maybe I should be taking this or that, or fish oil, or should I be drinking this much coffee? Because I can't wait till the next time I'm sick or something and I have to go into the doctor. So that kind of makes me want to, do more to try to be healthier. And it's so easy to talk to the doctor when we're walking. It's just such a casual atmosphere and everything, and I'm not afraid to ask him probably silly questions.
The reason that we started Walk with a Doc is because being active is so fun and it's so easy to do. Often you have to start slow, but very quickly you'll work up to a level that's rewarding on dozens of different levels. It improves just about any condition you can think of. You know, lowers your heart attack rate by 50%, lowers your stroke risk by 50%, cancer risk plummets, anxiety, depression, arthritis, all that stuff either never happens or happens at a much lower level.
My family doctor, she started giving me a little scare. I was gaining a lot of weight, and she started sending me to a cardiologist and a pulmonologist and all these different ologists and stuff, and saying, you know, if I want to live, see my kids grow up, I need to start working on my health and start walking and exercising.
I was diagnosed with breast cancer in 2014, and I continued to walk through my whole treatment. It was great. I looked forward to going every week because that's really the only exercise that I got.
When I looked around at my workplace, all my colleagues who were younger than me, with no exception, everybody seemed to have had some problem or the other. So it got me into thinking, you know, I'm working in a really stressful environment, but I don't think I'm doing enough to stay healthy. So in other words, I was really more concerned about where I was heading, even though at that time I seemed to be in okay health.
I'm overweight, but I love to walk. And I think when you go to Walk with the Doc, it doesn't matter. You don't have to have the fanciest shoes, the fanciest clothes. You just go up and show up. And there's people of all abilities that are there. They can be in a wheelchair, they could have a walker, they can be a 92-year-old man that we have with us. They can be a teenager or a young child that come, people with babies in carriages.
Walking and exercise is important, and I find that Dr. Sapir pushes in 150 minutes a week, and you know what, that is important, 150 minutes a week minimum. And I do find, you can find 15 minutes a day, breaks, spurts if you have to get those exercise minutes in. But you know what, do it.
The message being so simple, I felt really attracts you, and the environment they provide really endears you to the program, and the mission of the program really inspires you.
Everybody wants someplace where they feel okay, and I think with the way David runs Walk with the Doc, you just feel okay about yourself. You can go and say, hey, I saw that person last week. Even if I can only walk a half of the part of the walk, or I can walk the whole walk and stay 3 hours, everybody's accepting of you. And I think that helps you to say, wow, this is a different frame of mind. I'm okay. If I have to take 10 minutes to walk that quarter of a mile, it's okay. Or if I'm a speed walker and I've done 3 miles in the 10 minutes, it's okay, you're accepted. And it's just neat to have friends there, to go back every week and say, hey, how are you? Or if you don't see them, you're saying, wow, I wonder what happened to them.
When participants ask us questions, I hope it means something to them. To me, I would guess it's something that, if it's like me, something that maybe has been bothering them for a while, and maybe gets a little bigger than it needed to be as far as a fear and anxiety. And if I'm able, or the doctor's able to diffuse that, that's great.
The idea is so simple, right? You have a physician or two, along with some of their staff, organizing a walk, and the idea there is to involve the community around them.
If you can't do anything else, it's the best exercise. The more you do, the better you are. And it doesn't matter if you walk slow or fast. I know with breast cancer, the doctors were always trying to get me to exercise, and I really didn't have the energy to do it. But if I could get up on Saturday morning and go walk with the doc and to see my mom and my friends, that I walk with, that meant everything to me.
The environment really got me interested into visiting national parks. I visited any number of national parks over the next few years, going from hiking on the Cadillac Mountain in Maine to going on a really steep trail on the Na Pali coast in Hawaii.
Because I felt my health was controlling me. I'm controlling my health now by taking the steps of walking and exercising.
Traditional office visit, as you know, is business-like. There's nothing necessarily wrong with it, but the walk with the dog, that setting is incredible because there's no sense of inhibition, right? I mean, when you're in group, you could ask questions, or you also have chance to talk to one of these lead physicians on the side. They're so accessible.
At the doctor's office, you have like 10 or 15 minutes, and even if you had a list of questions, you have to talk real fast, and should I take notes or whatever? And it's just a lot more comfortable, relaxed atmosphere, and you kind of take your time, and you can get a more thorough answer maybe.
A lot of the ladies around my age, there's some that are younger, but we're openly be able to talk about some of our health care, just women health care. And some are older, and so you'll get a different perspective from somebody that's older. And then, we had, a young lady she's a college student. She was like in her 20s. So then we had a perspective from that.
To me, it goes beyond the medical aspect, really. These doctors and others, medical professionals who you walk with and you interact with, they almost become like your family.
I think also, like, when you think about it as far as even being able to talk to your doctor, I remember speaking with some of my friends and saying, hey, mention that to your doctor or speak up to your doctor. A lot of the ladies that I'm with, they're very open, and I don't think that's an issue with them. But for one of the younger ladies that we had, just her being able to, hey, I told her, I said, just ask or make sure that you share that with them. And where maybe if she wouldn't have been with our group and me expressing that, maybe she might have not had spoke up with the doctor. So I think it's just been helpful in that way.
Yeah, I don't know that I had met anyone that had breast cancer at the walk. I had talked to some other people who had sisters or other relatives or friends that had breast cancer. But it was just really cool this time. I'm walking, and it's the doctor's mother, and she had breast cancer 15 years ago, which made me feel really good because every time I meet someone that's had for 5, 10, 15, and I know a couple people that had cancer about 25 years ago. And every time I hear that, it just gives me more hope.
One of the ladies that I met there, she recently talked about having breast cancer, and she just talked about some of the things that she could eat or could not eat, and that was helpful. Of course, I haven't experienced that, but at least let you know that if something like that happened, you could come there and you could speak with that person about your health care.
It feels like you're valued. Hey, I'm here and someone's talking to me. I'm listening to a health objective. Maybe that can help me down the line. Maybe it can help me today. Maybe it'll never help me. But I'm valued. And I think that's what it makes people feel.
The doctor's office visit, traditionally you go into the visit, you are going to the doctor, and you're taking the step to go there, and you're going there for a specific purpose, and you're going there to, normally speaking, for some reason, either because it's your normal checkup or you're going for a specific reason. When you're going to walk with a doc, you are going for a reason there too. You're going to walk, first of all, but the doc is going there also. But you're going to find out when you're going to see the doc there, you're seeing him coming to you. He's coming to meet you at your place now. And there's a big difference because he's coming down at the same level as you. You're now equals. It's not a patient doctor relationship. It's friend to friend relationship. You're meeting and talking to each other as equals, but he's also giving you advice and as a friend.
I think that when I go to see a doctor, I'm on the same level as them. And I think David portrays that, and when he brings someone in, I think he picks people that have that same look in life of they're here, they know who we are, they're not going to talk down to you.
I gain as much, at least, as the person telling me the story, if not more. For me, it's such, and I think I can speak for all our docs, that it's such a little investment in time, and you get back so much more. The number that always comes to my head is 10 times more. It may be more than that, but it's a very little investment, and people are so appreciative. You know, I've established a lot of friendships through the walk that are extremely important to me.
I actually changed family doctors this year, and she said, well, you're getting older, I'm going to have some testing done. And she wanted me to go to a cardiologist, and I said, oh, David Sabger. And she goes, well, why? And I said, because I know David, I know he's my type of doctor that I want to go in and talk to. I don't want to go into someone that is in and out in 5 minutes and not paying attention to what is really important to me. And they will sit and listen to me and give me that attention. And David is that person.
The patients that you see on a weekly basis are I don't know if there's a better word than friends. So you're seeing them, just like we like patients to check their blood pressure on a regular basis at home or at the pharmacy. It gives us a much better idea when they come to the office and we're looking at 30 or 60 blood pressures compared to, okay, 6 months ago, this is what you were. That may be the best analogy, that it's just a whole nother, you see the whole landscape.
I am not an I love my doctor type person. I take responsibility for myself. So I always choose a physician, or I guess you don't sometimes get to choose a physician, but I always go in prepared with questions and have some knowledge about what I'm going to talk about or what the issue is that I would be going to see them for. And sometimes, physicians don't spend that time with you, or, hey, this is the way it is. Well, let's talk about some other options. No, this is what we're doing. Okay, bye. I'm not coming back. I mean, I've walked out of a lot of offices because of that's how I've been treated. And I won't be, because I'm a human being. It's important for me to be paid attention to and take the time to help me through that issue.
I think as a patient or a community member, to know that there's no financial incentive, that this person just cares about me, and wants to listen to me. I think that's a very powerful thing. It's an extreme satisfaction that, to me, and I know it's true from a lot of our doctors, our retention rate is much higher than if I had to guess, I would have guessed it would have been around 50 or 60%. It's much higher than that. It's probably low to mid 90s percentage of docs that keep coming back every year. So it's more than just that Saturday and feeling good, feeling complete, having your heart full. It's really hard to put words on it. It's every day in the office. It's when you hand a card to a patient and you're writing insulin for them and giving them simvastatin for their cholesterol or treating their blood pressure, but you're also paying down on principal, because a lot of that can be interest. But when you write them a script to go to walk with a doc, or you hand them a card, or you talk with them about it, capture their email, I swear it's been almost 10 years and I sleep better every night because of it. You feel like you're going the extra yard, and we've had so many docs say it's the most rewarding thing they've ever been a part of, and that gets back to this being a gift. We could have never, purposefully come up with an idea that ended up this good. We got lucky, but we have a lot of doctors that say, sign me up for the rest of my life. It's hard to put a finger on, but it's very powerful.
First, do what's necessary, then do what's possible. And soon you're doing the impossible. That was the quote by St. Francis of Assisi. So that really reflects my own story and the experience I had with Walk with the Dog.
There's a great phrase it's a quote from Francis Peabody that I absolutely love and I think is extremely important. And it is, the secret in caring for the patient is caring for the patient. And I think as long as doctors maintain that attitude, really can't go wrong.